And welcome back to Hometown Headlines Radio Edition for this Tuesday morning. Again, outside, it's absolutely gorgeous. 59 degrees right there, just really close to that record. Maybe we'll get down that low before the sun kicks in and gets things going. When that sun does warm things up, it's going to be a hot one out there. 91 degrees today. One more time, if you have any kind of respiratory problems, if you're going over to Bartow County or even to Metro Atlanta, watch out today. A Code Orange Smart Alert is in effect all day today. But again, that's Metro Atlanta and the Bartow County area. So over here, no such problems. It's going to be warm, going to be steamy. So if you got something to do, go outside right now and take care of that. It's going to be gorgeous out there. That means good news for the folks that are building the new Polk Medical Center down in the Rockmart, Cedartown area. Our US 278 is going to be a good day for part of the day to be out there doing construction work out there. That hospital is just coming along very nicely. Back here talking more about that right now. We are joined by the new administrator from the hospital, and that is none other than Matt Gorman, Administrator of Polk Medical Center. Matt, good morning, sir.
Good morning.
Thank you so much for joining us today. Congratulations. First off, I say new job. You've been here a little bit, but also what a great project. That thing is zipping along here. How are things going with the new hospital?
Things are going really well. They made tremendous progress on the facility as we've talked about. We actually recently surpassed 80% completion. So our general contractors tell us that the building should be substantially completed by the end of September, and we'll have plans to move in shortly thereafter.
All right, big grand opening coming up, that kind of good stuff?
Oh, absolutely. Our public relations department's hard at work.
Oh, they're always hard at work, aren't they? Those guys, they're never without a job, that's for darn sure. But no, good work going on there. Had a chance to drive by some of that during the weekend, doing some errands down there. 65,000 square foot facility, 25 beds coming up, around 23,000 square feet, new medical offices. Really a nice campus coming together.
Yeah, it's fantastic. Aside from just being larger, the new hospital's got a number of improvements. We're going to have much more parking available for our patients. The actual location of the hospital was strategically located so that it would be easier for patients to get in and out of between communities in Polk and the surrounding areas. And there are going to be a lot of improvements, even in the technology. In a new building, we have new technology that's on par with anything that you'd find in a larger hospital setting, and we're excited to be able to offer that to our patients.
Yeah, good point on that. I know the hospital board met last week, talked about some new things going on, some new wiring, some of the existing ORs here in Floyd Medical. Nice to see the new hospital is going to be coming in state-of-the-art equipment, state-of-the-art technology.
That's right, including 2 fully functional ORs. We're excited about bringing that service back to Polk County.
That's right. It's not been down there for a while. Good point on that. 25 beds, surgical wards. Really, in its continuing investment, Floyd has already done a good job. Nice facility you folks got over there at Rockmart at the intersection of 278 and 113 across from the Walmart Supercenter. A lot of activity in Polk County. Y'all see big things happening down there.
Oh, absolutely. Polk's a significant market for us. It's a growing environment. Our patients' population has grown even in the past few years. The relocation of that urgent care in Rockmart that you spoke of has been tremendously successful, and we expect the same thing from having a hospital facility that's going to be more accessible as well.
Well, that's a good point about that. The location is strategic. You got 2 population centers, Rockmart and Cedartown. It's going to be kind of in the middle of that. Of course, don't forget Aragon and other areas, Eastern Hills, all that stuff. It makes it a more convenient location for that. But also, I mean, just the opportunity to come in there, and here's a hospital that everybody admitted needed some work. It's been around, I don't know how many years down there now. Done its job, done a great job, nice part of downtown, but I mean, things have changed so much with technology, with the patient load, with the population. It seems, looking at some of the census information, that most of the growth is coming really over on that Rockmart side of the county.
Yeah, that's true. And again, the location of the hospital was keeping that in mind. So when we designed the facility, we designed it to be able to expand, so we have room on our campus. If we need to grow, we can do that, and we expect that to happen.
Talking about in the new hospital, of course, new facilities coming on. People always look at what's going on. Number one, you want some of the data. Looking at probably a $40 million investment here. In terms of jobs and workers, will we see an increase with the new hospital or status quo?
No, absolutely. As we grow volumes, which we fully intend to do, we'll have to add staff members. So expect that in the future as well.
All right. Again, that's all coming up. Like I said, it's coming together rather quickly. The construction should be wrapped up by September, with possibly opening up, you folks moving in there. Probably going to be a process that's going to take a few weeks, or is this going to be done boom, boom, boom?
No, you're right. It takes between 4 to 6 weeks is what we're expecting to move into the new facility. Probably around the first week or 2 in November we'll be there. All the equipment that has to be physically moved, relocated, set up, and recertified before we can see our first patients.
Yeah, I'm glad you mentioned recertify. People think, well, it's not a matter of loading up the U-Hauls and putting stuff in the back of the stuff. All this stuff's got to be recalibrated and tied in. So a lot of that's got to come together. So it's not a matter of just plugging things in like a computer, working it from home to work. It's a lot more, I'd say, a lot more advanced about that. We're talking about what's coming up with the new Polk Medical Center in really now going to be between Rockmart and Cedartown on Highway 278. Matt Gorman's here talking about that. One thing about this hospital, of course, all kind of great new things, the new technology, the new equipment, the 25 beds, the operating rooms down there now. This thing is being seen. Now, the location is strategic on 278. It really is kind of right, almost in the middle of the two communities, two growth centers down there, Rockmart and Cedartown. Really kind of bringing the two communities together, kind of a new wrinkle down there. How's all that coming together?
It's coming together really well. The Cedartown Polk County Hospital Authority showed a lot of foresight when they chose the location of the new facility, and like you said, to bring together the communities and for this to be, one of the largest economic investments in the area in recent history, if not in history in its entirety. This is a great opportunity to bring those communities together and support a local hospital. And try to increase, the growth of the area and to serve both of those constituents. This investment, one of the largest, if not the largest investment of this nature in Polk County history, could be a nice milestone for that. But also, what y'all done quite well is to service this new hospital. A lot of utilities, a lot of the infrastructure had to be extended on 278 out from Cedartown area. What I'm hearing from some of the folks in the county government down there is that this thing, not only is it going to be a brand new hospital, better service for the community, it's also going to be an economic engine for the community. Absolutely. Healthcare services are extremely important to industry and other commercial ventures that are looking at an area to develop in, and we're hopeful that having this new facility in a location where there's some property, having the major utilities involved, that we're going to see substantial growth, and this will really be a destination for growth and to create really a lasting impression on the community in the way that we're able to serve our patients. Is it safe to call this thing a phase one? I know we talked a little bit about this earlier. There is I don't say it's a blueprint for growth, but you guys think there's more coming up here? That's right. If the hospital fulfills all the expectations that we have for it, we will expand. There's room on the side, as I sort of alluded to earlier, for additional expansion, including potentially even another medical office building in the future. So we have long-term visions for that site and what it can become. Talk about the medical arts building. You're going to have 23,000 square feet for that. That's going to be for some of the doctors who do serve the hospital, kind of relocations or open up opportunities. I mean, will it be Floyd only people or open to any medical? We actually have an area in the new medical office building that's going to be dedicated. We call it a timeshare space. It's where different specialists can come in and lease space for a certain period of time and come down and practice and have extensions of their main practice. So the medical office building will be open to providers from all around the community. Good, and a nice idea for that. Keeps those folks nearby. Makes that commute time, even though I know people will say, well, gee, it's in Polk County, it won't be that much of a commute. Yeah, it is a commute, and it will keep folks kind of handy there. Matt, got about a minute left. Again, let's go over the timetable one more time. Construction should be done in September. Correct. And then move-in possibilities. Walk us through that one more time. Sure. So we actually have an entire transition team that's in place that's laid out an extensive roadmap of the activities that have to take place. As you can imagine, there's licensure issues, there's certification, accreditation issues, all those things that we've already talked about. But as you mentioned, the hospital will likely be substantially completed with a certificate of occupancy towards the end of September. We will start to relocate equipment and supplies to the new building, and over a course of about 6 weeks, we'll actually transition into that building, and it will become our main center of operations probably the first couple of weeks of November. All right, great opportunity there, Matt. Thank you for joining us. I wish you and your staff and your group the best of luck with that. It's a heck of a challenge, a lot of work, but I mean, also look at the opportunity. That's going to be something that's going to be a new community landmark. Congratulations to you and your team for getting that nailed down. Thank you. We're excited to have the opportunity to serve. All right, we'll talk more about that coming up as we get closer to the big grand opening. Right now, time for a break. Hometown Headlines, your radio.